Hi, so it's about 7 o'clock. We'll go ahead and get started. We're going to cover some resources today and then pick up next week on the medical record and the required elements of the medical record next week. So today, March 9th, we're going to cover today, March 6th, time just flies by. We're going to cover some valuable resources for you. So I'm sharing my screen and you can see I have the Coding Spot website up. So when you're a current student of the Coding Spot, you get to use the resources available on our website. So you should all have a password on how to access our website. If you see, I just went to current students, and then you will enter the password provided by our Director of Career Services. And then once you are able to log in, you'll see that we have all kinds of videos up here, how to tab your book, different tools that you can use. And so we have an April 1st, and no, it's not April Fool's Day, it's legit. We're doing a revamping of our coding of the CPT books, and we're going to include some highlighting and some tips on how to highlight your books, including the tabbing of each book. So we're doing the 2017, and we will upload those videos onto here. So April 1st, we'll have new videos up here, and we'll start recording our WebExes again at that time. We kind of went back and forth on it, but we decided that recording them is probably the best thing. So with that being said, April 1st, kickoff on the new videos uploaded to thecodingspot.com for our current students. In the meantime, I'd just like to show you guys some other tools in case you aren't aware that we have them. So we have all kinds of PDFs uploaded onto these, onto the current students portal of the Coding Spot. And we're going to cover a few of those today. So we have some how-tos, right? Exam tips, using the ICD-10 tips, inpatient tips, CPT tips, med term tips, anatomy tips, and we have some section review from our coding workbooks, answers for the section review and for the workbook. So these are all great tools that we have available for our current students. But I'm going to go ahead and come back up to the how-tos because we added a few recently, and we're going to cover them today. So the first one we added is what is MLN Matters. And this is something I want all of my students to sign up for. It is MLN Matters, Medicare Learning Network. This has such valuable tools for us as coders. I use it on a day-to-day basis, and it's something as coding students you should really get familiar with. You could really impress future bosses with this kind of knowledge. And it's updated all the time. So Medicare, CMS really has some great innovative tools, and we're going to look at my favorite tool that MLN CMS has today, but it's really important to stay on top of all of these guidelines and regulations, and CMS is a governing body, so it's very important to stay on top of that. So this is something I want all of you to do. I want you to go and sign up for MLN Matters, and you'll get updates sent to your email address whenever new things are coming out from CMS. So it's the Medicare Learning Network, and obviously the blue highlighted text is going to link you to places on the CMS website. But this is a tool on our website. It's called What is MLN Matters. If you click on this, you'll be able to link to it and sign up for the CMS updates. So that's our first one. I also wanted to show you the cms.gov website. If you sign into the Medicare Learning Network and you look at the Medicare Learning Network products, you will see all these different valuable tools as coders we can use. So again, this is my absolute favorite coding tool. CMS has really become progressive and innovative as far as their educational resources go. So again, you can link to this from our signing up for the Medicare Learning Matters on the Coding Spot portal. So we're going to go ahead and check out our first tool, Medicare Preventative Services. Like I said, this is my favorite. I'm very partial to it. So once you start coding, depending on what kind of coding you do, you'll most likely be involved with Medicare, no matter what it can be. Inpatient coding. 1 second, let me just make sure we're all muted. There we go. Okay. So no matter what type of coding you're doing, you're going to be affiliated with Medicare, most likely in some way. Whether you're coding for your doctor's office and you have Medicare patients, whether you're coding for your hospital setting and you have Medicare patients, whether you're an auditor or you're doing risk adjustment coding, no matter what, Medicare you're most likely going to be affiliated with it some way and have to know a lot about it. So that's why this Medicare Learning Network is such a great tool. Let me quit talking and I'll just start coding. As you can see, these are the Medicare Preventative Services. Preventative services are those freebie services that, you're allowed a wellness visit every year or every 2 years. And you're allowed, your children get a well child visit every year, and that one's free and there's no copay affiliated with it. That's the Medicare Preventative Services are the same. Your annual wellness visit, if you're on Medicare, you get an annual wellness visit annually, so once a year, and there's no copay involved. So these are the preventative services that have been deemed necessary and beneficial as a preventative service. So I'm going to go ahead and click on alcohol misuse screening and counseling. This is our first one, and it's in alphabetical order, so it's not by most important. But you can see all this information that they're giving us on this very common preventative service, right? We have our codes. So it's also referred to as the screening and behavioral counseling interventions in primary care to reduce alcohol misuse. It's in our HCPCS book, right? And our HCPCS codes G0442 and G0443 represent this screening and counseling session. And you can see the guidelines around it. So it also, if there were a select group of ICD-10 codes for this screening, they would be listed there. And we'll see a few of those when we click on a couple other things. Who's covered? All Medicare beneficiaries are eligible for this alcohol screening. And Medicare beneficiaries who screen positive, those who misuse alcohol, but whose levels or patterns of alcohol consumption do not meet that criteria for dependence, right, for alcohol dependence, they're eligible for counseling if they're competent and alert at the time counseling is provided, so they can't be drunk, and counseling is furnished by a qualified primary care physician or other primary care practitioners in a primary care setting. So what does that mean? That means you're going to your PCP, your primary care doctor, and they're giving you this screening or they're giving this counseling session. You're not going to, your urgent care and getting it. You have to go to your PCP and get it. How often can you get this screening? G0442, for those who screen positive, 4 times a year. For G0443 and for G0442 annually, so once a year. And then if you screen positive, you can get that second counseling code 4 times a year. And so if you happen to have your HCPCS book right here, you can go ahead and just go to your G section and look up the code. And it's good to do this as you're learning your codes. You really want to start looking up your codes. So we see annual alcohol misuse screening, 15 minutes, right? So it's kind of hard to see. You probably won't be able to, but look that up in your book. And if you want to highlight, this would be a good place to highlight annual. So you know that this G0442, you can get this once a year. And then the G0443, it doesn't give you a guideline right there in the HCPCS book about how often you can get this. So write it there. 4 times a year if tested positive. Copayment, coinsurance waived, and deductible waived. So it's giving us all the information here on the Medicare Learning Network website about these specific preventative codes. And then we need to take that information, and since we're going to be testing, right, we need to take this information and write it next to our codes. And then in the coding world, we'll know how to access this resource and look for these specific codes when we need to, because trust me, you will be looking it up. So I'm just going to use my back arrow. Oops, didn't mean to go that far back. And now we'll look up the annual wellness visit. So the annual wellness visit, this is a huge code. We actually did a whole presentation for it when I worked for a major payer in the past. I mean, it was a conference with like 100 docs in their primary care offices, all about the annual wellness visit and how to make the most out of it. So the annual wellness visit, it has a couple HCPCS codes that go along with this. And as you can see, they're G codes too. So you can kind of start to understand what the G codes in your HCPCS, the book you hardly ever use as a coder, what those G codes stand for, right? They're Medicare. So we know that if we see a Medicare code like this, maybe we should look in our HCPCS under the G's, because it's becoming kind of a pattern, right? So for the initial visit, your first annual wellness visit, it's G0438. And there's guidelines around that specific Medicare visit, right? Once in a lifetime. You will only get your G0438 once in a lifetime and never again, no matter what. G0439 is for each subsequent encounter after that. So your first year on Medicare where you go get your annual wellness visit, you get it and you get coded a G0438. That's your initial visit. Every year after that, the code's going to be G0439. So as an auditor doing auditing, one of the first things I did when I started auditing a payer's records was I ran a report for this G0438 over the same member used multiple times. And it was amazing how many times this was miscoded and actually coded more than once in the patient's lifetime. So that was a big win from an auditing perspective. So we see who is covered, not within 12 months after the effective date of their first Medicare B coverage period, and have not received an initial preventative physical exam, an IPPE, or an annual wellness visit within the past 12 months. And again, we see the frequency around it and what the Medicare beneficiary pays. Copayment again is waived and deductible is waived. The IPPE, it's another way to look at that, and I can actually show that to you. We can skip all these and just go to the initial preventative physical exam for a second. This is, think about this as the welcome to Medicare visit. So this is your first, hey, look at it, it's also known as the welcome to Medicare preventative visit. This is your first welcome to Medicare visit. This is your exam. It's like your annual wellness visit, but it's the first time you've ever got it done, and it is your welcome to Medicare visit. The codes for that, and you see that we have G0402, right? That's our IPPE, welcome to Medicare visit. And then we have the EKG tracing, the EKG interpretation report. Those are also specific codes listed here. Who is covered? This is important. So all new Medicare beneficiaries who are within the first 12 months of their first Medicare Part B period. Let me just see if we have a chat here. So the question is this only for people in their 60s? That's something that I get asked a lot, about, because that's what you think. Oh, I finally qualified for Medicare. No, it depends. If a person is on some sort of disability from a young age, then they might qualify for Medicare too. So it's not necessarily for only patients in their 60s. You can have a 20-year-old who's on Medicare too. So that was just a question that we got asked in the chat box. Great question. So again, just going on, you see that there's specific rules around who is covered and the frequency. This IPPE visit, once in a lifetime, and it must be furnished no later than 12 months after the effective date of the first Medicare Part B coverage period. Mumbo jumbo translated. What that means is once you qualify for Medicare, you have 12 months to get this IPPE. If you don't get it within that 12 months, then you're never going to get it. You'll just go straight into the annual wellness visit. Another way to look at it is you qualify for Medicare, you get your IPPE. You won't get that initial annual wellness visit that we just looked at for another year, at least, after the date of your IPPE, right? So there's all kinds of little rules around this, and CMS really kicked this off recently, this website. They've been making innovations to their learning center for a long time, but this is pretty brand new and it's pretty easy to understand. So let's check out bone mass measurements, right? So here we're going to start seeing additional codes, not just our HCPCS codes, but we see them too. So bone mass measurements, they have HCPCS and CPT codes affiliated with it. We can see here we have our 76977. Sorry, I'm just going to reach down and grab my CPT book. CPT, right? So these 76977, the 77078, the 77080, and the 77081 are all CPT codes. While that G0130 is a HCPCS code, and we still don't have any ICD-10 codes yet, but we have the exact codes that were needed for these very common Medicare procedures that we're going to be coding as coders frequently. Who's covered? Women determined by their PCP or other qualified or other non-physician practitioner, NPP, to be estrogen deficient and at clinical risk for osteoporosis. So now we see that not just anyone's going to go and qualify for this bone mass measurement to get it free, right? You might be able to get it if you don't apply to one of these who is covered, but you're not going to get it with no copayment or a deductible way. And it can be very, very pricey. So your frequency to getting these is every 2 years, more frequently if medically necessary. So if there's a reason that your provider deems you medically necessary to get this test more, then it would be waived. But they would definitely have to document that medical necessity in the medical record. Let's see, we aren't going to have time to get to all of these, so let's get to a couple. They're all so popular that it's hard to just pick. I know it's probably sick, but I love all of these. So let's go to our depression screening, right? The annual depression screening, 15 minutes, G0444, it's a HCPCS code. We can see that it's covered all Medicare beneficiaries can get a depression screening. And you might get a depression screening even if you're not on Medicare. You know those questions that your provider asks you at your well visit, you know, those strange questions. If you answered yes to are you depressed, or how often would you consider yourself depressed? If you answer a certain way to any of those questions, then you might qualify for a depression screening. But as far as Medicare goes, annual depression screening, 15 minutes, and it has to be furnished just like in the other ones by a PCP, by your primary care. That just really means that you can't go to the urgent care and get it done, or to the inpatient hospital and get an annual depression screening. Let's see. Diabetes screening. We have an ICD-10 code. Yay. So, Medicare only pays claims for DME if the ordering and DME supplier, do we know what DME is? Durable medical equipment, casts, wheelchairs, diabetic foot insoles, stuff like that, who are actively enrolled in Medicare on the date of service. Tell the Medicare beneficiary if you are not participating in Medicare before you order DME. That's just letting if you were on this site looking as a patient or as a provider. So we have our HCPCS and our CPT codes. These are all CPT codes. We can tell because they don't start with a letter, right? So, of course, the ICD-10 codes start with a letter too. But if we're talking between HCPCS and CPT codes, we know that HCPCS codes, these weird ones, start with a letter. So we have our glucose test, right? And then we have our ICD-10 code Z13.1. Frequency, 2 screening tests per year for Medicare beneficiaries diagnosed with prediabetes, and 1 screening per year if previously tested but not diagnosed with prediabetes, or if never tested. So let's just take a quick time out and check in here. We can tell here that you can tell by these frequency, 2 screening tests per year for Medicare beneficiaries diagnosed with prediabetes. How would we know that? How would we just pull that code out if we were coding this record rate? This is exactly what coders are for. Coders would look at the documentation in the medical record. They would determine if this person was not diagnosed with prediabetes or they were never tested, and that could be the 1 screening per year. They would follow those frequency guidelines. So that's why it's really important for coders, because this is how these providers are getting paid. And from a payer perspective, and payer, I mean insurance, or you would think about it the same way, but you would just make sure that you are paying something that meets medical necessity, right? It also lets us know here to append a modifier, TS, when submitting claims for Medicare beneficiaries with prediabetes. This is just a wealth of knowledge. So I would definitely make sure that you get familiar with this kind of thing. So let's hop over, let's go to our Hepatitis B vaccine and administration. So another covered service from Medicare are most of our vaccines, including the administration of the drug, because there's 2 codes for those, right? We have here our hepatitis B vaccines, and you can see the different types that they have. So we have a vaccine for an adult dose. We have a Hep B vaccine 90740 for someone who's on dialysis or is immunosuppressed, so their immune system is suppressed. We have a specific vaccine for Hep B for them. Adolescents, they have a specific vaccine, so they have a specific code, and pediatric, right? So an important thing to take away from this little this little code section right here is, if you were to go into your CPT book and you were to look up these codes, right? The important thing here, I'm sure that you could tell, would be the age, right? That's the difference in these codes right here. So that's something that you could highlight, right? So if we look up 90739 in our CPT book, we see hepatitis B vaccine adult dosage, 2-dose schedule for intramuscular use. The important parts about this code in the language here is adult dosage, 2-dose, and intramuscular. So it's telling us a couple things about the vaccine. How much is the dose? How many times? How frequently? How many times do you have to come back? Whatever. What's the age that this vaccine applies to? And how are you going to get this vaccine? Intramuscular, right? So these are things you can highlight in your CPT book as it applies to the code. And that's for the test, for taking your exam, and even for coding in your occupation. Those are going to be things that are going to separate codes that it's going to be important to pay attention to. We also have the administration of the hepatitis B vaccine. So you see that the vaccination and the administration are actually coded separately. We have our Z code, Z23. Make sure you go and look that code up after this. Who is covered and the frequency. So who is covered? Medicare beneficiaries at an intermediate or high risk for contracting Hep B. And it talks about who is not eligible as well. So let's see. Let's hop over and let's look at this behavioral, intensive behavioral therapy, IBT, for obesity. This is a very popular code right now. So we have 2 HCPCS codes surrounding this. We have G0447, face-to-face behavioral counseling for obesity. G0447, so the G and the number of digits here, G0447, this should signal us that this is a HCPCS code. Okay, so for the first 15 minutes of our counseling for obesity, G0447. If we were going to do group counseling, and that would be 2 to 10 people For 30 minutes, we have G0473. So there's different guidelines around that, and we can read about that here. We also have all of our ICD-10 codes, and look at those. So those codes, if you were to go and look them up right now, those are your BMI codes, your body mass index codes. And what they're doing is telling the provider and the payer, what BMI does this patient fall into? Because if they're getting counseling for obesity, their BMI is going to be qualifying as obese or greater, right? And so that's what those BMI codes signify. So make sure you look up those BMI codes at some point. Tells us who is covered. So obesity, and look, you have to meet the body mass index for obesity. You have to be competent and alert at the time of counseling, and it has to be furnished by a PCP or other primary care practitioner in a primary care setting. We have our frequency here. So the first month of this counseling, 1 face-to-face visit every week. So that's a big deal, right? That's 4 times you can see your patient for this obesity counseling. Months 2 through 6, 1 face-to-face visit every other week. And months 7 through 12, 1 face-to-face visit every month if certain requirements are met. And here are the requirements here. At the 6-month visit, a reassessment of obesity and a determination of the amount of weight loss must be performed. So really what this is saying is that Medicare and your payers want to know the progress is being made for these members that are getting this IBT counseling. To be eligible for additional face-to-face visits occurring once a month for an additional 6 months, that Medicare beneficiaries must have lost at least 3 kilograms. So they not only have to qualify to continue to receive counseling, they have to be making progress, right? Medicare beneficiaries who do not achieve a weight loss of 3 kilograms during the first 6 months, a reassessment of the readiness to change in BMI is appropriate after an additional 6-month period. So if you don't make it during that first 6 months, if you aren't losing weight, then you'll have to take a 6-month break as a patient before you qualify for it again. So there's very specific guidelines around these codes. And I'm telling you, these are the most popular Medicare codes that you're going to see. We have, I think we have time for maybe 1 or 2 more. Let's look at the medical nutrition therapy, MNT. So there's a group of codes here. We have 97802. That's our initial assessment and intervention, face-to-face with the patient, each 15 minutes. The next one, we have reassessment and intervention, set 97803, face-to-face with the patient, each 15 minutes. So by each 15 minutes, what do you think they mean? Each 15 minutes. So can there be more than one? Well, let's see. We'll get to that. G0270, reassessment, subsequent intervention for change in diagnosis, and G0271, reassessment and subsequent intervention for change in diagnosis each 30 minutes. So here, under our HCPCS and CPT codes, we have a combination of our CPT codes and our HCPCS codes. Who's covered? We have to receive a referral from your treating physician. So what does that mean? That means that your PCP or whoever is treating you primarily is going to refer you for whatever reason to medical nutrition therapy. You have to be diagnosed with diabetes or renal disease, or who have received a kidney transplant within the last 3 years, or services provided by a registered dietitian or nutrition professional. So you have to have these services provided by an RD or a nutritional professional. So this doesn't necessarily have to be performed by your PCP, but you have to be referred by your PCP. Frequency, first year, 3 hours of one-on-one counseling, and subsequent year, 2 hours. So that's where those each 15 minutes and each 30 minutes come into play. You might have a visit where you have an hour of counseling. And so in the first year, you would have that hour of counseling. As you can see, if it's your initial assessment and intervention, 97802, you would do 97802 times 4, right? That would be 1 hour. And then you'd still have 2 hours of counseling for that year available. And you can see from this too that Co-payment and deductible is waived. These are preventative services. So they have established that there's good in them, right? Oops. There's good in them, that they're preventative, and hopefully they will help by treating these at this point. Hopefully it'll help lower cost over the long haul. Okay, let's just do one more. The pneumococcal vaccine and administration. And look, it gives us a link to additional information. Medicare B immunization billing for more information. We have our HCPCS code, and we have our CPT codes, 90670, 90732. Then we have our G code for the actual administration of the vaccine. So remember that those are different. And then we have our Z23 for our ICD-10 code. So look up that Z23 because it is a code you will see very, very commonly. Frequency, initial pneumococcal vaccine to Medicare beneficiaries who have never received the vaccine under Medicare Part B, and a different second pneumococcal vaccine 1 year after the first vaccine was administered. So again, I really love these resources. You can print this if you'd like to print this, but make sure you bookmark it. So I want to show you one more thing. Hopefully we have time. Another tool we have here in our how-tos is how to use the NCC. Just dropped my HCPCS book. How to use the NCCI edits. If you're going through the CPC or the CRC class, you've probably seen this come up. So this is actually the tool on how to use the NCCI edit tools. And so I would read through this. And then we also have proper use of modifier 59 uploaded here under how to use, how to properly use modifier 59. This is taken directly from the CMS resources. So it tells us right here the different proper uses of modifier 59. Modifier 59 is a confusing one, so we really wanted to put a tool up here that would help guide that. So when you get some time, make sure that you're going over these tools that are available for our current students in the coding spot. If for some reason you don't have the coding spot current student's password, or you lost it, whatever, just reach out to either the instructor at thecodingspot.com, or you can reach out to ERWIN at thecodingspot.com and just request that you get that current student's password again. Next week, we'll pick right back up on our medical records and breaking down the elements of that. But until then, make sure that you familiarize yourself with these different resources and make sure you really get into those CMS resources because you'll use them throughout your coding career. And if there's any questions, I'll stay on the line for a while. I'll go ahead and mute my line until then, so have a great evening.